Gentlemen, this is our final doctor today. Let's welcome Dr. Huang.
Thank you very much, James, for the very flattering introduction. Today I'm going to talk about back and neck pain from desk work. So it's really catering to all the working adults out there and how to fix it before it becomes a chronic issue. So I believe a lot of us have experienced back and neck pain at least once in our lifetime. And statistically speaking, at least 1 in 2 of us will have neck and back pain. And at any one point in time, there will be about 1 in 10 of us that will also be experiencing neurological symptoms such as numbness and tingling. And most of the time, I get asked by my patients, when are these symptoms worrying and when do they need to seek medical help? So I hope by sharing today what I have here with you guys, I hope to really shed some light on the questions. And then later on, we'll be going through some of the Q&As, questions that you guys have submitted as well. And that will actually really conclude whatever doubts and queries we have about this topic. So without further ado, let me jump straight to my slides. So this is a bit about myself, very long, but actually at the end of it, what I want to share with you here is being a spine orthopedic surgeon. I also does a bit of trauma training as well as endoscopic training internationally. And the topic for today, which I have just touched on, what we'll be covering today, I have really divided into 6 sections. And basically, I will start off with explaining why desk work causes pain. And then we go a bit into the common myths and debunk. And I'll talk about what can we do to actually sort out the issues and the 3 pain hotspots. And then how ergonomic actually fixes what ergonomic fixes that actually works for the working adult, especially in the office. And then lastly, I'll touch on when to actually seek professional help. So before we start, you guys must be wondering whether this webinar is for you. I mean, this talk is for you. So if you are a remote or hybrid employees, you have long hours of desk work, you have been experiencing recurrent tightness of the neck, shoulder, or lower back, or you're just a team lead that's trying to build a healthier workplace culture so that your team doesn't experience such symptoms, then this talk is probably something that's beneficial for you. Now, why this topic matters? Why is office work and neck and back pain an issue? Because 60 to 80% of the time, statistically proven that we have seen in papers that says that office workers actually report recurring back and neck pain. And a lot of time, these are actually very disabling condition. They will give you symptoms that will prevent you from being your best, and you will inevitably need to take time off work. And that lowers the productivity of the whole team. A lot of working adults, especially in Singapore, when it is a very competitive society, you spend about 8 to 10 hours of daily sitting time for many desk-based roles. So really, is it a healthy lifestyle for you? Is it really productive for the company? This is something that we've got to think about. And then whenever you look at your computer, your laptop, or even your handphone, and you are actually having a forward tilt of your neck, it gives you about 3 to 5 times strain on the neck. Similarly, when you sit down, there's a multiplier effect on the stress of the lumbar spine as well, and that will give you neck pain and back pain. Now, we do a quick self-check over here, and I'm going to ask the audience, does any of this sound familiar to you? Number 1, do you have neck tension that builds up by mid-afternoon, even before the day ends? Number 2, when you go to the toilet and you look into the mirror, do you have a rounded shoulders when you see your reflection? You think you look better than that, but actually, when you're tired, the posture is all wrong. Do you have a lower back ache after sitting for more than an hour? And do you have headaches that starts at the base of your skull, especially at the end of the day? And last but not least, the occasional tingling and numbness in your hands or your legs that makes you a bit worried, and then you will start to come and see me. So why does actually desk work hurt your spine? At the end of the day, the desk work doesn't really hurt your spine directly, but it is more of the habits and the posture that you adopt during the day work. When you have a forward head posture and you're leaning towards the screen, you shift the weight of your head and whole body, and you shift the center of gravity from the spine. And that creates a lot of load for the muscles, as well as the spine in terms of its structural stress. You have a long static sitting position, and you stay in one position for too long, it reduces blood flows and stiffens the muscles and joints. You have a slouched, unsupported spine, especially when you sit with a chair without a lumbar support, and that causes a lot of strain on the discs and the ligaments, especially when you do not have strong muscles. And finally, a mismatch of a desk setup. Monitors are too low, the keyboards are too high, screens are too small, you need a screen, you tilt your head forward and have a look. Your handphone screen is too small, you're playing too much games on a handphone. All these are just reasons that adds up. And small misalignment adds up over an 8-hour day, and that gives you the eventual problems of pain. How it escalates? Usually it starts off with mild pain and aches, and then you can tolerate it for months and years, and it becomes a habit, day-to-day habit, and you start treating it as a normal symptoms without any thought and without any second thought put into it. And then you develop muscle stiffness after that, and it becomes tension. And that's because your body is trying to protect itself from further damage. And when you have decompensated and your body no longer can protect, that's when you have nerve irritation, where you have these bulges, you have ligaments thickening, and then you have bad posture that causes nerve irritation due to the compression of the nerves in the spine. And when you don't seek treatment, really unfortunately, when you don't seek treatment for such condition, pain actually can generate itself and become a self-recurring issue, and pain itself becomes the pathology. So what we are really trying to do right now, or what I'm trying to advise all of you right now, is really to prevent a simple condition from escalating into a chronic issue, because the chronicity of the symptoms actually makes it a lot harder to treat. Now, why this matters, I think I've touched a bit on it already. So we have three segments on this. Firstly, your neck. With a forward tilt, especially when you look at laptops, your handphones, it causes what we call a text neck. Yeah, when you're texting, it's called a text neck. Yeah, I just learned this as well from one of my patients. So when you have a text neck, that's when you have a lot of slouching, a lot of neck pain, and you know our body is all connected. So when you have a text neck, it goes to become it can bring on a rounded shoulders when you start slouching in front. And rounded shoulders actually is also because you have a forward tilted posture, where you start reaching for your keyboard, your mouse, and unknowingly you guys will actually adopt this posture for the whole day. And then finally, because the lumbar spine is also not supported, you have low back pain. We go on to whether a few of the myths and the facts that I'm going to share with you here. They always say, patients always ask me what is a good posture to adopt. I always tell them the best posture is your next posture. So you need to keep moving. Even if you adopt a most neutrally aligned posture, if you hold it for more than an hour, 2 hours, or a whole day, 8 hours, you tend to have pain. And that's because your body is not used to being in a stationary position. And therefore, your best posture is your next posture. You got to keep moving. Mobility is key. Motion is lotion. So you got to keep your joints supple, and your muscles will be also, your joints and muscles supple, and therefore your symptoms will not happen. And you'll feel more comfortable doing your daily chores. A better chair alone will fix your pain. Obviously, that's not right, because there are a lot of other stuff that matters, even your own body height and daily habits. Pain means you should stop moving entirely. Not entirely true. Sometimes if you experience a bit of aches and pains, it's because you haven't been moving, and therefore you need to move more. A gentle motion, gentle movement and stretching usually speeds recovery from muscular pain, which is the benign kind of pain that you may have. So how do we set up a workstation correctly? Usually, I will advise my patients, 4 big points. Monitor is at your eye level, so you do not need to forward tilt your head. You do not need to actually have a downward or upward gaze. And you can keep your cervical spine in a neutral position. Your feet is flat on the floor. So if your feet you're tiptoeing, or you're actually squatting on your chair because you're too tall, those are bad for your lumbar spine. Elbows at 90 degrees. A lot of us probably don't adhere to this because you don't get to decide your workplace desk and tables and your chair height as well. And all of us are of different height. So workplace that have standing desks and standing working station is actually the better ones, where it allows you to sit and stand and keep having a change of posture regularly throughout the whole day. But unfortunately, not all offices have that, so only you can know what to do for yourself. And finally, lumbar support engaged. You can put a cushion, or you can find a chair that has actually a lumbar support that curves inward and support the lower back when you sitting down. Some things that are worth the investment. Again, four things that you can decide whether you want to put some cash into this. They are not cheap, but they can help you in the long run. Ergonomic chair, adjustable height, seat is actually quite supportive. It doesn't sink down, and you have a good lumbar support where there's a lumbar curve at the back to prop up your lumbar spine. You have a monitor arm and stand that really gets the screen to be true to your eye level. And most importantly also, a lot of people was telling me like the keyboards and the mouse, they are very curious, why does it matter? It matters because most of our keyboards and the mouse, if you belong to my era, they are all wired. So if you're wired and the wire is short, then you tend to reach out and you want to actually have a forward posturing. And nowadays with wireless keyboards, wireless mouse, you have more freedom to actually decide how you want to sit and how you want to actually properly align yourself to the workstation, and that is naturally better for you. I put this slide up here because, like I said just now, any good posture that you adopt and you don't move, it becomes a bad posture. So really, you need to take regular movement breaks in between, and do simple stretches, especially after a 30 to 60 minute sitting posture. I'll advise my patient to actually get out about 40-45 minutes and do a 15-minute stretch. You can take a walk, take a toilet break, stretch your neck, your shoulders, and then you can change your position and really just have a breather, and that will make you walk the longer distance eventually. So remember to take breaks, set a recurring timer if you need to. Don't rely on a willpower because none of us have that. And eventually, I think over many years, you'll realize the benefits that it'll bring you. If you really cannot stand up in the office, then these are the micro stretches that you can do. So I understand some of you may have, a workplace condition that doesn't allow you to stand up, you're too shy to stand. Then try and do this whenever you can. You do a side stretch of your neck, your ear towards your shoulder like that, and like that. And you hold it for 15 to 20 seconds each time. And then you have a seated spinal twist where you gently rotate your body. I'm feeling a bit of ache now. Yeah, and that helps also. And you hold it for about 10 seconds. And you can do it as regularly as you want to. And the wrist and forearm stretch also helps, especially when you're typing furiously for about a few hours. And then the ankle circles will keep the blood flowing in your calves so that you don't develop, blood clots and, leg swelling at the end of the day. These are simple things to do that you can do it microscopically, and none of your colleagues will judge you for it because they don't even know about it. So if you cannot stand up, these are the micro stretches you can do. And then strengthen and mobilize daily. Again, 4 exercises. I decided on 4 because I think that's the easiest to remember. Of course, there are more. You can actually Google them online. Now, core strengthening will be the mainstay of treatment, or rather mainstay of action for you to actually prevent further episodes of back pain and neck pain. You have shoulder blade squeezes, simple chin tuck exercises, and chest openers when you put your arms behind you and then you just stretch your chest out. A lot of people don't know this, but the chest and your upper back muscles are actually connected to your neck. So if you have a chest tightness and upper back tightness, it will eventually give you neck issues as well as headaches. So you can try it right now if you are at a desk watching the webinar. Stand up, you can push back from the desk and stand tall. You do a 5 slow rolls of your neck in each direction. You can do a lateral rotation, you can do a lateral flexion, rotation, and you see whether you feel the ache slowly leaving your neck. Do shoulder squeezes. So you pull your shoulder back blades up, you hold for 5 seconds, and if you cannot see it, I shall turn my body and let you see. So this is how you do it. And you hold for 5 seconds, because anything less than 5 seconds doesn't really work. And do it as many times as you want to, because that actually loosens up your shoulder muscles. And do chest openers where you clasp your hand behind your back, lift it slowly, and you need to really stretch out your pectoralis muscles. With a good thoracic extension, then your neck can be in a neutral position. When your thoracic spine is actually slouched forward and flexed, your neck cannot be in good position. And no matter what kind of stretches you do to your cervical spine, the pain will still be there. And finally, do a 2-minute of easy walking. I always tell my patients to take toilet breaks and say that they need to go to the washroom, because nobody can prevent you to go to the washroom, even your boss. So then you have the excuse of walking throughout the whole day. Now, this is going to be one of my last few slides, I think. Know the limits of self-care. Most of the time, back pain and neck pain are actually very benign condition. You get to treat it yourself. You don't really need to see me. But when do you really need to see me is when you have these symptoms happening to you. 4 symptoms again. Pain radiating down your legs, your arms, pain that wakes you at night and doesn't go away. You have any numbness and weakness of all 4 limbs, actually, your hands and your legs. And by adhering to a physical therapy program and you don't see any improvement in a few weeks' time, even though you change your lifestyle, you change your activities, then maybe it is time for an evaluation. So with that, I do a recap with you guys. Now I increase a bit. I put it as 5 points now, because I think you guys can remember 5 points at the end of the day. Pain builds up gradually, so small habits actually will prevent the big problems, and you got to start now. The neck, upper back, and lower back are your 3 hot spots. So take care of them, and they will take care of you in the future. Set up your monitor, your chair, your keyboard to match your body so that you do not feel, your body does not need to undergo this unnecessary stress every day when you work. Move every 30 to 60 minutes, even for a brief 2 minutes. that it will help you enough. And if you have persistent or radiating pain, that is when you need to come and see me. Thank you very much.
Well, thank you very much, Dr. Huang Yilun, for the super informative presentation.